Everyone, I'm Bob Sanborn, President and CEO of Children at Risk. We're a statewide group that does research and advocacy on the whole child, how children are doing, making sure that every child can be successful in the state of Texas. Today, we're talking about a brand new study that we're very excited about, focusing on sleep and the children of Houston, children of Texas, and specifically the children of Austin today as we talk about this. And one of the things that we understand is that in our state, and certainly here in Austin, we're going to see specific areas of our community that are sleep insecure, where kids are having a harder time succeeding because of many factors, including poverty and other factors, but sleep is an essential part of this as well. We have a great panel for this press conference that I want to introduce you to. First off, Sharon Jones is the Chief Equity Officer at Children at Risk and the Director of the Texas Racial Equity Collaborative. Sharon, welcome. Nice to have you here. Also with us is Omar Torres. Omar is with the Mattress Firm, and Mattress Firm has been a big partner with us at Children at Risk as we've endeavored to do this big sleep study. Omar, thank you very much for being here. Sharmali Roy is here. Sharmali is the Director of the Center for Social Measurement and Evaluation at Children at Risk and the primary author of our study. And so we're excited to have Sharmali here with us as well. Dr. Courtney Robinson is with us. She's the founder and CEO of Excellence and Advancement Foundation. We'll get her ideas on what's happening on the ground in Austin as it relates to this sleep study. Then we wanted to go out to the schools. Ralph Henley's here. He's the 11th grade assistant principal with Manor Senior High School out of Manor ISD, right outside of Austin. We're excited to have Principal Henley here as well. And then we also have Guadalupe Fernandez. She's the director of the Children's Immigration Network. Y con Guadalupe nos vamos a hablar un poco en español para la prensa latina. So we'll be doing that right near the end of the interview. So one of the things that's really important here is that sleep is an important asset for us as we endeavor to be successful with our children. One of the things that our mom or someone in our family always said, if you don't get your sleep, you're not going to be as successful during the next day, right? You need to get your sleep. And I think sometimes what we understood is we understood that to be true, but we also didn't always listen to that advice. And I think that's what's happening here in the state of Texas and really across the nation, is that we understand sleep is important, but we're not always listening to that when it comes to our children. And we're certainly not listening to that as when our policymakers sort of make decisions around our children as well. So that's an important thing to understand. We know that in the state of Texas, there's a significant portion of our children who are not successful for a number of reasons, including sleep. And so we'll talk a little bit about that today. We have developed maps in each community around our state. And for here in Austin, and you can see zip code by zip code, where we're finding sleep deserts. Where are there areas where children living in those zip codes are having a tougher time being successful because the idea of sleep and good sleep is just not something that's happening in these sleep deserts. And as policymakers, we want policymakers to really understand that this has a big impact on the success of these kids. This has an impact on their academic success and certainly on their health. Study after study finds that kids who are lacking in sleep security are much more likely to have issues with being overweight or obese. These are kids that are much more likely to try out risky behavior. These are kids much more likely to have mental health issues. And so when we see these things, it alarms us, and we should be alarmed. The other thing that we find is that pediatricians, by and large, get this idea that sleep is important, but very rarely are they asking parents, how is sleep going in your household? And very rarely are they giving some advice to families. And so that's something that we want to work to change as well. So in regards to public policy, we understand that a lot of the tools available to us as policymakers include the alleviation of poverty. And those are things that we want Texas to focus on, but we also want Texas to focus on this idea of time change and what's happening and the disruption that time can provide to kids, whether it's start times in the school or whether it's daylight savings time. Our study looked at 11 different variables when it came to sleep insecurity. We looked at family and child poverty. We looked at the rate of shift work that the parents had. We looked at crowding in the homes, mobility rate of these kids, and also the student homelessness rate. In regards to health, one of the things, or a number of the things we looked at were, of course, childhood obesity, mental health, food insecurity, and hunger. the disabled child population, and then how kids are working as well. These were key things that contributed to creating these maps and this focus on sleep and security. In Texas, when kids don't get sleep, they're going to be academically unsuccessful. And when they don't get sleep, they're much more likely to be unhealthy. So we need to understand that this sleep thing is very important. We want kids in Texas to be successful. And one of the things we know is that if they don't get enough sleep, the future for little Texans is not as bright. And we need to be focusing on that. One of the things that we're emphasizing in this study is recommendations for parents. Parents are the front line of defense, right? They're the first responders. They need help from the community on a lot of stuff, but they also can really begin to formulate what's happening with sleep. And so we're asking for a couple things. Set a regular bedtime. Whenever possible, set a bedtime for the kids. That routine, all of us who work with kids understand routine is very important for kids. We also understand that a set bedtime really helps in terms of sleep. Read a book together. Even if it's the same book every night, the idea of reading or singing and spending a little time with your child is a very important thing. Taking a walk together sometime in the late afternoon, early evening, it's just emphasizing that importance of exercise. A little exercise goes a long way towards more restful sleep. Eating dinner together. We know that this idea of the family, whenever possible, eating dinner together is a very good thing. We don't do it enough. Sometimes we can't do it as much as we want to, but to do it whenever possible is important. Keeping the room cool, making sure that there are no screens, computer screens, smartphones, tablets in the bedroom with the kids is another important thing. And then finally for babies, making sure that we're following some of the pediatric advice that we're getting from our pediatricians. For policymakers, it's all about the alleviation of poverty. Things like the child tax credit would do a lot towards sleep and security and helping families with sleep and security. And there are many things that are very important around poverty alleviation in terms of policymaker decisions that I think would be important. And then I think another important thing is daylight savings. Whether it's daylight savings or daylight standard, the change in time has a big impact. That's an easier fix. The more important fix is to focus on the poverty issues, but it's a fix nevertheless. In Austin, Travis County, a couple of things that we found. First off, Austin was the least sleep insecure area of Texas. We know that Austin is a little bit more affluent than a lot of the rest of the state. That had something to do with it. But we do know that within Austin, we found over 38,000 children that were living in zip codes that are severely sleep insecure. These are areas that we should be worried about. We should be worried about the success of these 38,000 kids. And then when we looked at specific schools, we saw Linder Elementary in Austin ISD and Beatty Elementary in Del Valle ISD. These are schools smack in the middle of sleep insecure zip codes, these sleep deserts. And it should be a red flag for policymakers to say, what are we doing within those schools to try to make sure that those families can be successful and those children can be successful. So when we look at these things, we see in particular those schools, high rates of mobility. That should be the first instance where we say, what are we going to do to change outcomes? And sometimes those solutions are easier than other times. But the point is that sleep this is a new lens to look at the success of children and to see how successful they can be. Sharon Jones is our Chief Equity Officer at Children at Risk. Sharon, give us an idea from your perspective, because we also saw a lot of sleep inequity. I talked a lot about sleep insecurity, but we saw a significant amount of sleep inequity in the study.
Thanks, Dr. Bob, and thanks Mattress Firm for this opportunity to talk about sleep as a basic necessity for all kids and as a human right. Even in Austin, which is one of the most sleep secure areas, we know that where a child lives decides how well they sleep. And without support for parents and families and schools, kids won't be able to develop well, and there won't be equity in the way that they develop. Neighborhood factors such as light, and noise, and pollution, crime, anything that alters a sense of safety, access to green spaces or grocery stores where they can get fresh foods and what they need for the nutrition, for nutritionally to grow. And then we also know things such as red lighting, segregation that stems from historically biased policies manifest today in sleep disparities and the problems that follow that. Even though Austin is one of the least sleep insecure portions of the state, there are greater disparities between those who are sleep secure and those who are insecure. And we measure equity by the size of that chasm. So we have to look at the challenges that kids face in sleep insecurity communities so that we can overcome those so that there is an equity in how they develop. And as you mentioned, we measure these things by our sleep index variables, which include low socioeconomic status, their sleep environment, and individual level factors such as whether or not kids are working, which Mr. Henley will be able to talk about that a bit with kids in high school and other individual factors that make up these variables.
Thank you, Sharon, very much. We're very happy with our partnership with Mattress Firm in this. Omar Torres is here. He's from Mattress Firm in Austin. Omar, I wonder if you might be able to give us an idea. What was the ingredient that you guys were looking for when you thought about let's partner with Children at Risk and let's focus on sleep? And I just want to commend you for this idea of looking at the whole child. But talk a little bit about Mattress Firm's commitment here, Omar.
Sure, absolutely. So you mentioned it earlier, the kids are the future of our country, right? So for us, through this partnership, we're able to highlight the importance of sleep, the conversation around sleep, and how important is sleep for kids. We also talk about the insecurities related to the ability of quality of food, education, shelter, and things of that, but we take for granted quality of sleep in children. So by highlighting the conversation and switching the conversation around sleeping for children and the impact of the lack of sleep on our kids, how it affects their health and their well-being, we can now focusing on how we can improve the sleep of our children so they can dream big, right?
Dreaming big, right? That's sort of perfect, right? If you can sleep well, you can dream big. And so thank you very much, Omar, for that. I'll come back to you a little bit later. Sharmali Roy is with us. She's the director of the Center for Social Measurement and Evaluation. Sharmali, doing this study, what were the big surprises for you in looking at sleep in Texas?
So again, thankful to Mattress Firm, providing the opportunity to look at this a little bit more in depth. I think the biggest takeaway was just generally the idea of sleep, as we were discussing, as a basic need, how much it makes a difference in terms of preventing other health effects later on. Sleep plays a role in developmental issues in terms of early child development, brain development in babies and toddlers, and then it continues on into teenagers in terms of, how well they adjust to anxiety, because sleep is a time to sort of, replenish, get rid of the toxins in terms of dreaming, sometimes allows you to even work out those problems and things that are bothering you. And so if you don't have adequate sleep, those things end up manifesting in anxieties, suicide ideation for teenagers. So just that level of importance was how much it factors into various levels of physiology, biology, mental health was a big part of this. The other thing was also just understanding how the disparities really play out. As Sharon was pointing out, we looked at quality and quantity. So you can have, 8 hours of disturbed sleep where you're waking up and there's noise. And if you have crowding in the household, if you have sharing rooms, the two, three people in the same room might have different sleep habits, and that could keep the other person from actually getting quality sleep. So we looked at quantity and quality. So, but looking at disparities, even like 1 hour difference, if you have noise pollution and light pollution where you live, that over time adds up and ends up in, very destructive outcomes in terms of the differences and what children, how they develop reading, other things like that. So,
Sharmali, I was, and I know you were as well, in Austin itself, over 38,000 kids living in sleep deserts. The fact that policymakers may disregard a whole 38,000 kids, I guess in some ways it should surprise us, but in other ways it should surprise us a lot. This is, a lot of children that we're looking at, and we're able to project out that these kids are going to have a hard time succeeding. Was that a surprise to you?
I think one of the things about Austin is that it seems, again, each city has different dynamics going on, the politics and what's happening in the whole environment. But in terms of most of the children are sort of concentrated in certain zip codes. So in a way, it makes it that if you just tweak some policies or some ways things are done in certain communities, it could affect a large number of children. So policy in that way has a great effect in terms of small policy changes can probably affect 5 zip codes and then help these 38,000 children that we were just talking about.
Yeah, exactly. Thank you, Sharmali, very much. Dr. Courtney Robinson is the founder and CEO of Excellence and Advancement Foundation in Austin. And Courtney, give me an idea from your perspective on the ground dealing with kids. What do you find surprising? What do you find distressing? What was your take on this study and the sleep insecurity that we're seeing in Austin?
Well, for me, I don't think that I wasn't surprised by the disparity because the disparity is seen across all domains. When we think about school to prison pipeline, graduation rates, college going rates, we could go on and on about the disparities. And those disparities, we understand, are rooted in a history of systemic racism and oppression among groups. And for us as an organization, we serve about 95% of our students are African American and Latino, and all 6th grade through 12th grade. So we're dealing with adolescents. So for me, I love the study because I thought it provided a wonderful opportunity. There are so many things that parents cannot control in the child's environment. They can't control what time school starts. They can't control the ways their children don't have access to technology. They can't control the ways in which they have access to teachers and principals and what that looks like in the school environment. But with the opportunity to change your child's sleep patterns, I think as a nonprofit who serves youth and families, we also have an opportunity to build this sort of awareness around it and really think about the opportunities. Adolescent children, getting them to sleep is difficult. I'm a parent of a 20-year-old and a 14-year-old. It's impossible with adolescents. Their schedules, their friends, social media, it goes on and on and on. But if we really dig deep and think about the ways in which we can support children in this way, I'm excited. I think this is an opportunity to really do some great work around helping parents solve for the thing that they can really solve for amidst all the things that they cannot solve for.
Yeah, I want a follow-up question, and Sharon Jones loves to ask this question, so I'm sort of stealing it from her. But when you look at the pandemic and the impact that it's had on our kids, how hard, we're already talking about 38,000 kids. You and I know the numbers of kids that are struggling is far higher than that. But as we try to get back to, whatever normal was, but try to get to a place where our kids can be successful after the pandemic, are you seeing the same sort of, it's like working triple overtime to try to get there?
It is triple overtime. The pandemic took a tremendous toll on the families that we serve. But I think we need to think about getting back to normal differently. I don't think we need to get back to normal. I think we need to think about it like the Netflix of education in terms of how do we do this differently? How do we consider time spent in classroom, time spent in instruction, time spent, I think we need to revamp. And I know that's asking a lot of our 100-plus-year-old educational system, but it's time. It's past time. Our children need more. Our world is different, and they need something different. And so I don't want us to get back to normal. I don't even want us to think about getting back to normal because children suffered in normal. They suffered in the pandemic. And so how do we change that? How do we create a space where children are thriving?
Yeah, absolutely. And when you consider the numbers of kids that are not on a normal pathway to success, it does seem, look, for the 60% plus kids that are growing up in low income families in Texas, we're going to do different things. And as you said, I love this idea that this is a way for a small start for parents, but there's a lot more that we have to do. Ralph Henley is with us. Ralph is a principal out at Manor Senior High School. He's assistant principal for the 11th grade. Ralph, thank you for being with us. Give us an idea from your perspective. This sleep study, you're seeing these teenagers, you're seeing them react to too little sleep. What's your take on it, Ralph?
Well, I think it's an additional issue because these young people are on the precipice of adulthood, and having that lack of quality sleep affects their cognitive ability to do some things that we would consider normal. They make a lot of careless mistakes. They continue to not want to participate in certain things because of a lack of sleep. We try on this campus to make sure that our teachers teach from bell to bell, and we try to make sure that the students are being engaged on a consistent basis. But still, you know, you're fighting a battle with other things involved. You know, they have to work against peer pressure. They have to work against lack of sleep. And with that lack of sleep, again, comes sometimes lack of motivation, sometimes physical ailments. We have students who drive to school who are carrying. If you sit out here in this parking lot at 4:55, you can see some carelessness. And I'm not saying that's because of sleep depravity, but we're talking about students whose frontal lobes have not really developed. They're still children, and that lack of sleep can contribute to poor decision making.
Principal Henley, let me ask you one last question. You know, one of the recommendations of this study is this idea of eliminating daylight savings or daylight standard, right? Sort of sticking with it. You have kids coming back from spring break, also adjusting to time. How disruptive is that when you have sort of a differential in time there? How disruptive is it to the kids and their learning?
It can be very disruptive. One of my duties is I say good morning to all of our scholars coming in from the bus, and you can see the difference when they come in because of daylight savings time. It is night and day. The good mornings that I give are not reciprocated by at least 70%. You know, they're just not in the mood to be instructionally active at that time. They want to go back to bed. And then, you know, when you add to that the Instagrams and the TikToks and the Facebooks that they're staying up late at night doing, it can be a challenge to come back to us instructionally.
Someone really wants to get a hold of you, Principal Henley. I can see that. So, but thank you very much for that. I so appreciate it. And it's a little thing, and it's certainly not the biggest thing, but it's something that could be fixed. I mean, which is a hopeful sign as well. Lupe Fernández, para la prensa latina, ¿nos puede hablar un poco en español de qué estamos hablando hoy?
Claro. Hoy estamos orgullosos de presentar nuestro estudio titulado Descanso y Resiliencia, donde exploramos la inseguridad del sueño en Texas y aquí en nuestra región de Austin. Mattress Firm apoya el buen dormir y estamos agradecidos por su colaboración en este reporte. La comida, la vivienda, la ropa y el sueño son necesidades básicas que todo niño merece tener cubiertas. Todos los padres quieren satisfacer esas necesidades básicas y entienden la conexión. Así como mamá nos contaba, dormir es importante para nuestro bienestar. El estudio nos muestra un número significativo de niños en nuestra región y en Texas que no duermen bien. Y sabemos que la falta de dormir perjudica el desarrollo, la salud y el bienestar de nuestros niños y de nuestras familias y el éxito de nuestra región. La desigualdad y disparidad del sueño en el estado y en nuestra región es muy alarmante, así como lo damos en el reporte. El reporte también destaca recomendaciones para asegurar el bienestar de los niños a través del sueño, así como recomendaciones para padres para asegurar que nuestros hijos puedan dormir, como establecer un horario regular para dormir, hacer ejercicio, cenar juntos y sanos como familia, asegurar que el ambiente esté fresco para mejor comodidad mientras dormamos, y controlar el tiempo que nuestros pequeños usan pantallas y tecnología, en vez que lean mejor como familia para que puedan descansar los ojos antes de dormir. Igualmente destaca recomendaciones de pólizas para apoyar a padres de familias en asegurar el buen dormir de nuestros hijos, así como pólizas que alivian la pobreza en nuestra región que directamente contribuye a la desigualdad de sueño, y seguir apoyando los recursos que existen en nuestra comunidad, así como nuestras escuelas, así como el Distrito Escolar de Maynard y organizaciones como Excellence in Advancement que apoyan a nuestras familias con las necesidades básicas que todos los niños merecen y pólizas que eliminan las barreras para que las familias puedan acceder a las necesidades básicas. Igualmente, los quiero invitar a nuestro evento mañana, que está titulado Una oportunidad de luchar, necesidades básicas y éxito infantil, donde vamos a explorar los desafíos que enfrentan las familias de hoy para satisfacer las necesidades básicas de sus hijos, desde el acceso de alimentos, vivienda e incluso el buen dormir. Hablaremos con expertos que atienden a nuestras familias, donde explorarán las soluciones que existen para satisfacer las necesidades de nuestros niños y aprenderemos juntos qué podemos hacer para brindar a cada niño la oportunidad de aprender, crecer y prosperar. También les aviso que tendremos interpretación en español disponible durante el evento.
Gracias, Guadalupe. Omar, ¿nos puede hablar en español un poco sobre el partnership entre Children at Risk y Mattress Firm?
Claro que sí. Mattress Firm tiene años que estamos tratando de cambiar la conversación y enfocarla en un punto donde podemos traer la conversación a la mesa de la importancia del sueño, ¿verdad?, de nuestros niños. Como lo mencioné en inglés, creemos en Mattress Firm que los niños son el futuro de nuestro país y queremos poder brindarles no solamente un buen dormir, colchones, ¿verdad?, pero más que nada la información que un padre necesita, una familia necesita para poder proveer esa información para sus niños y para que atrayendo a la conversación no solamente a la disfuncionalidad de tal vez de la provisión de comida o tal vez la educación, sino también retomar la conversación en la importancia del sueño, nuestros niños puedan dormir bien y puedan soñar en grande.
Gracias, Omar. And I want to finish up, because Austin is so important for our community. But when most people think about Austin around our state, they think about the capital and legislation, and they forget that we have this vibrant population in Austin, many of the children who are struggling to be successful, but there's so much potential in Austin to be able to lift up every child to be successful. And I think this is what one of the points of this study is, that all of us need to be able to focus on those areas that we can easily point out, whether it's food insecurity or childcare deserts or sleep insecurity deserts. We want people to focus on this to make sure that children can be successful. And that's what it's all about. And so, Principal Henley, we thank you for the work that you do at Manor and for all the educators that do this. Dr. Robinson, I'm enamored of your work, and I look forward to a rich possibility of partnership in the future. I just think there's so much that we can be doing for our children in the state of Texas. Sharon, Sharmley, Guadalupe, the work never ends, but we continue. So thank you all very much. I do want to say everyone here is available for interviews. If any of the media are interested in special interviews, we're happy to do that. So thank you all very much.
Dr. Bob, let's invite everyone.
Yeah, Sharon.
Let's invite everyone to our summit tomorrow at 10 a.m. In partnership with the Mattress Firm. We're presenting A Fighting Chance, a summit on basic needs, which is a deeper dive into the study and the maps and all the information you got tidbits of today, as well as more conversation with experts about the importance of sleep for kids and family in Texas.
Thank you, Sharon. I meant to have you bring that up earlier. I just missed it. So thank you all very much. Everyone get some good sleep and when it's appropriate, and we'll go from there. Thank you all very much.